Thank you for joining us today on the program Healthy Living. I'm Adisuwa Usa Uwage. Yesterday was 14th November, and the world stood still as more awareness was created on the issue of diabetes mellitus. And we've been told that it's a scourge and it is ravaging our country, so as we speak. Painfully, a lot of persons are living with it and do not even know, because we have this poor health habit. People don't like to go to the hospital. People don't like to do routine checkup until they are very sick. I mean, critically sick at the point of death even. That's when some persons will even go to the hospital to go check what is wrong with them. It is imperative, very important, that you go to the hospital, even when you're not sick, to go do a thorough check. It would not cost you so much. It will cost you because assessing healthcare in Nigeria is not so cheap. It's not so cheap, okay? It's quite expensive, but it will do you a world of good, you know? If you can do that at the beginning of every year, or at the middle, or at the end, you'll be doing yourself a world of good. And at least you will rest assured that your health is good enough. People may just drop dead and that is it. People will just slump and die. You never can tell what has been happening to them. It was not a sudden thing, you know. It's one of those things. So let us cultivate good habit towards our health. We're going to be looking at diabetes mellitus. It's not a new topic, but you see, it is on the rise now, on the high side now. A lot of persons are down with it, and some don't even know what to do, and some will keep asking the wrong person's questions. So today we have brought the right person into the studio to talk about diabetes, causes, how you should know, you know, a lot of things that you should be aware of, and of course the risk factor. So join me as I make welcome Dr. Osareme Osumbo. Is a consultant physician from the Central Hospital, Benin City. A pleasure to have you join us today.
Thank you, madam, for having me.
Okay, now we're looking at diabetes, doctor. At least the world celebrated a day. Okay, there was a day set aside to create more awareness, okay, on the issue of diabetes. Please tell us more about that day, which was on the 14th.
Okay, well, thank you once again for having me to the ITV studio. Yes, diabetes mellitus is usually celebrated worldwide, and yesterday being 14th of November is usually the day that is commemorated worldwide, and every year usually go with a theme. So this year had the theme of access to diabetic care. If not now, when? In fact, a very big question was being asked, and for the sake of emphasis, that theme is going to continue even for the next 2 years in the course of celebrating this World Diabetic Day worldwide.
Okay, that's quite interesting. Access to diabetic care. If not now, when? That's a huge question. How do we answer such a question?
Yes. Well, there are a lot of answering that question means looking at all the various challenges that are militating against diabetic patients or people living with diabetes mellitus, assessing care. And there are a lot of things that are involved in taking care of a diabetic patient, and not just medications alone. The first thing is the education of the individual about his or her condition, because just now not many persons are enlightened about what diabetes mellitus actually is, and to even make it worse, when they present in the hospital, because of the nature of you know, hurriedness of doctors attending to these patients, you know, and maybe not the number of patients they also need to attend to, you know, the time is not always there to, you know, educate these patients about what exactly they have. So access to good education about the disease is lacking just now in many climes. And of course, access to medications is also there. And medications is not just the pills or tablets that they swallow. There are also injectables, the ones we refer to as insulin. And not many diabetic patients just now are able to access even this insulin when they do need it. And of course, there are other areas that are posing challenges to their care.
Okay.
And these are areas in terms of nutrition, you know, even access to other disciplinary care, because diabetic care is not just a one discipline that is involved.
Okay, we're going to look at all of that in a moment, but let's quickly refresh ourselves by educating me and other persons watching this program on what diabetes is. How do you get it?
Sorry, I didn't get it.
We want to know what is diabetes.
Okay.
Talk to us about it, educate us a little bit, because some persons don't even know, like you said, the education is not there.
Yes, that's really lacking. The education is not there, and you see, diabetes is a complex disease. It's not as simple as many people, you know it. Okay. Some people just think that diabetes is about when someone is having to be urinating frequently. And mind you, there are a lot of conditions that could make somebody urinate frequently. And that doesn't necessarily mean that the individual has got diabetes mellitus. So diabetes, by way of definition, like I said, is a complex disease. That means there are more than one disease entity that is actually contained in diabetes mellitus. And when you find that, we say that's a syndrome. Okay. So diabetes mellitus, number one, is a syndrome. And then number two, diabetes mellitus is usually characterized by high blood sugar. So, and that's what we refer to as hyperglycemia. Now, what brings about this high blood sugar? It could be as a result of lack or either absolute lack or relative lack of insulin. And it doesn't just end there. Diabetes mellitus also could result from abnormal metabolism of the nutrients that we take in. And the major nutrients that you and I eat is composed of carbohydrates, protein, and lipids or fat and oil. So when there is an abnormality in the metabolism of these nutrients that you and I take, and eventually is supposed to be broken down to simple sugar that the body requires, the tissues, the organs, the cells in the body requires, and there is no vehicle. The vehicle there now is what we refer to as the insulin. There's no vehicle to transport this end product of your carbohydrate, your protein, and your blood sugar to the needed organs that require them. The end result is that the individual begin to have a high level of blood sugar, and that can manifest in different clinical entities like having to pass urine frequently, or refers to as polyuria, or having to eat excessively, what refers to as polyphagia, or even having to be losing weight, because sometimes the individuals might just be losing weight despite the fact that he or she is eating so much, or at other times he might even be adding weight. You understand? So these are some of the components that defines the entity we refer to as diabetes mellitus. So it's not just to go about passing urine frequently. That is what diabetes mellitus is about. And let me quickly also say here that a lot of people who have this disease don't even manifest with these symptoms that we have highlighted just now, especially the ones that have the type 2. Because diabetes mellitus is classified into three major types. We have the type 1 diabetes mellitus, we have the type 2 diabetes mellitus, and of course we have the gestational diabetes mellitus. And of course there is a fraction that we refer to as others, where quite a number of things will be responsible. So these are the very broad classification of diabetes mellitus. And for the type 2, which is most common among individuals, the individual may not even manifest with symptoms. In fact, as a matter of fact, over 50% of those who have the type 2 diabetes mellitus may not have these classical symptoms that we mentioned earlier, like having to pass urine frequently.
So how would they now know? Unless they go to the hospital? Yes,
that's why access to care is important. And like I was earlier, talking about earlier, access to care even includes access to having to have your blood sugar monitored or having your blood sugar checked. So some persons, they are incidentally discovered to be diabetic. Maybe they went for conditions like malaria or maybe typhoid fever or a pneumonia, and then in the course of just being tested for blood sugar, they were found to have a very high level of blood sugar. So it could just be incidental, and that is the category where the type 2 people belongs. So incidental, and then for some, maybe on routine check, maybe medical fitness examination for being employed on a new job, or for one thing or the other, and that is how they are discovered.
Okay, what about type 1?
Yes, for type 1, well, let me say here that in the past, the categorization of this diabetes mellitus used to be based on age. People who are known to be, of course, younger than 30, 40 years of age, they were those that we were referring to as the type 1 diabetes mellitus patients. And then those who are above the age of 30, 40 were those that were referred to as a type 2. And then, of course, the gestation, just as it implies, is having to do with pregnancy. So, but now that is changing just now, because we are beginning to see people who are even younger than 40 years of age having diabetes, especially even the type 2, which we used to see more in the type 1 diabetes mellitus. And for type 1, like I defined earlier, is found in those who lack insulin. Insulin is a vehicle. It's a vehicle that carries the blood sugar into the various cells for usage. You understand? So if insulin is lacking, absolutely, the individual may fall into the category of those who refers to as the type 1. But where insulin is lacking relatively, then you can say he or she falls into the category of type 2.
Okay, doctor, can you just tell us this? What is usually the cause of lack of insulin in the body, or at least some insulin but not quite adequate?
Yes, or that we are looking at the causes now.
Yes.
You see, the causes of diabetes mellitus, because we've already established that insulin is lacking. Either the insulin is lacking absolutely, like you find in type 1, or is relatively lacking, like you find in type 2. So for those who are lacking insulin, a lot of factors can come into play. And these factors are broadly classified into hereditary factors and then environmental factors. But let me say here that environmental factors play a leading role, a larger role in the causative risk factors or factors for insulin lack or for diabetes mellitus. And these environmental factors, they are quite huge in number, and they cut across even our dietary lifestyle. You know, people who live sedentary lifestyle, who don't burn what they eat, you understand? The people who are overweight, people who are obese, you understand? People who even now they are finding out that even living in the urban area is also posing a risk factor to people now beginning to develop diabetes mellitus. So urbanization is also playing a leading role. And of course, in the urban area, there are a lot of toxins, you know, chemicals that are released into the air, and some of these chemicals can have effect on, you know, the production of insulin in our body from the organ that produces insulin, which is the pancreas. You understand? And of course, sometimes it might just be infections, especially viral infections. You know, lately we begin to see patients who have COVID-19 even now developing diabetes. So viral infections generally are notorious for even causing insulin, hindering the action or the synthesis of insulin. You understand? So these are some of the factors that could be responsible. Remember I mentioned hereditary.
Yes.
Hereditary means it's being inherited. You understand? There are some genes that can run through individuals or run through families that can, you know, make insulin action or secretion to be deficient, and that will now make the individual to succumb to developing diabetes mellitus.
Okay, let's look at the life of a diabetic patient.
Yes.
What kind of life would that person be living without access to drugs?
Yes, for patients who is living with diabetes, if the an individual does not have access to drugs.
Because the drugs are quite expensive.
They are, yes, they are. If the individual does not have access to medications, of course, it means a death sentence. You know, we are in 2021 now, and it's just exactly 100 years when the first insulin, which was one of the magical drugs that was used, you know, for treating diabetes mellitus patients, especially those ones that have type 1, was discovered. And prior to that discovery, those who developed type 1 diabetes mellitus were like a death sentence. They hardly will live up to even a month, because, you know, imagine a situation where you are suffering in the midst of plenty. You have blood glucose, which is supposed to give you energy to carry on with your day-to-day activity, but you are just urinating it out and your cells are not utilizing it. Why? Because the vehicle to carry the sugar to the cells are not there just now. So when insulin wasn't there, diabetes mellitus diagnosis was like a death sentence. You know, but thank God it's over 100 years now since insulin was discovered. But then a lot of patients still cannot access or, you know, afford to get insulin, for those who are using insulin. And then for those who are using the oral drugs, the tablets now, the pills, the same goes. You understand? Because sometimes they may not even be on one particular drug for the control of their blood sugar. You understand? And God help them if hypertension is also coexisting with it. Because many a times, for those who are diabetic, over time, you begin to also see them develop hypertension. You know, that's where you hear people say hypertension and diabetes are like twin brothers.
Evil twin brothers.
You understand? So access to medications is a big challenge, and that is why the world is really looking in this direction to see how the patient's body in the area of accessing this care that has to do with medications, you know, will be lightened.
Okay, you did say that having diabetes now is not a death sentence. Now talk to me, what is the lifespan of a diabetic patient?
Well, the lifespan of a diabetes patient varies. It varies from individual to individual. I have got patients who have been diabetic for over 10, over 20, some over 40 years, you know, and it depends on the individual. And why do I say so? The care of a diabetes is not just swallowing the pills.
Okay.
You understand? You know, we started by saying that diabetes mellitus is a complex disease. It's actually a syndrome that has other conditions associated with it. So the care of a diabetes is not just to regulate the values of the blood sugar just now. It's not just to know that my blood sugar level is doing well. It goes beyond that, because excess blood sugar in the body that is not being utilized can have its deleterious effect in different organ systems in the body. It can have the effects in the eyes, it can have the effects in the kidneys, it can have the effects in the skin, even the genital areas. You understand? So the complications that goes with diabetes are so numerous, and that is why the lifespan of an individual also is dependent on how well that individual is getting care in all these various areas that diabetes that is not well controlled can affect. So,
okay, so how well should this patient get care? What are the things this patient should do and not do?
Yes, you know, we've said earlier that there are some risk factors that can make one predisposed to developing diabetes mellitus, and largely they are environmental. For the environmental ones, we control them. And what are these environmental factors? Are eating habits. You know, individuals need to be educated on how to eat. You know, we must eat healthily, and a lot of people don't eat healthily. I can give you an example. You see people, especially these laborers, you know, they can take a bottle of, a 50 cl bottle of sugary drink.
Okay.
You understand, with a heavy loaf of bread. And these are all carbohydrates. They can do that as breakfast, they can do that as lunch, and they can even do that as dinner. You know, the same goes for the man who eats pounded yam. You understand, probably as dinner, and then maybe rice in the afternoon as lunch, and maybe bread and tea. you know, in the morning.
Unfortunately,
You know?
that's all we have in this country, carbohydrates.
Well, that's all we have. I agree with you, but you know, that is why as part of the theme for the diabetes World Diabetes Day this year, access to healthy nutrition is also one of the area of access to care that is being looked at. Because just now, many people just eat with the head knowledge they have about diet. There's no input of a nutritionist, there's no input of a dietitian. You understand? And we always tell diabetic patients that there's no diet like diabetic diet. Diabetic patients are supposed to eat like every normal person, where the food is balanced, has carbohydrates in it, has protein in it, has fat and oil in it, has water in it, has minerals in it, and even has vitamins. You understand? So all these are supposed to be components of a patient who is said to be diabetic. And that is essentially what you and I, who are not diabetics, will also eat. You understand? So we lack access to nutritional care and advice. You understand? And that's one area of focus in this year's World Diabetic Day.
So it's important that a diabetic patient sees a nutritionist or a dietitian.
Yes, very important.
But that's a very difficult thing to accomplish for some who can't even afford 3 square meals a day. You know, you find out that some diabetic patients, all they eat is beans, 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 and beans all the way.
You are very correct. You see, unfortunately, even some health practitioners even advise patients in that direction, that they should shy away from carbohydrates. It's because they take plenty of carbohydrates. That is why they have come down with diabetes mellitus. But that's not correct. You know, like we said earlier, diabetes mellitus is an abnormality in not just carbohydrates, but also proteins and fat metabolism. You understand? So shying away from just carbohydrates does not solve the problem. But rather, what solves the problem is having all these food nutrients in small quantities. In small quantities. So small quantity is a key of all these different nutrients. Carbohydrates in small portion, protein in small portion, fat and oil in small portion, and of course some minerals, vitamins, which you get from fruits, should also be part of it, and the water.
That's quite interesting. A diabetic patient can actually eat everything, but the watchword there is in small quantity. You portion it. Okay, the number is 052-290573. I know that by now you should have quite a number of questions you want to ask Dr. Sereme. Please call in and ask questions relating to what we're discussing today. Don't shy away. Like they say on the street, if you hide sick, you go hide die. You know, ask the doctor a question now. 052-290573. All right. So ask doctor a question, anything and everything you need to know about diabetes. Okay, doctor, while we're waiting for calls, let's look at diabetes in children. How do we manage it?
Okay, yes, you know, diabetes in children is the one we refer to as the type 1 diabetes mellitus. And in children, most often than not, is the absolute lack of insulin that you find in them. So they have to be dependent on insulin, and for you to get good care of a child who is diabetic, the parents must be very supportive. You understand? Even in terms of administering the insulin injection, because insulin is not a pill that you swallow. You understand? It has to be administered through as an injection through the skin or even through the muscle. So the family support is very key for you to have success in the care of the diabetic in child.
You know, sometimes you see some persons who are diabetic with ulcers, foot ulcers and all of that, some injuries that will never heal. You know, how can that person live with it? Or what's responsible for that?
Yes, what's responsible for that, especially if the individual has diabetes, is because the blood sugar is not controlled. You know, when the blood sugar is excessively high, it begins to act as a nidus for infection. And these infections can be anywhere. It can be on the skin, it can be in the ear, it can be just in the throat, anywhere. It can be in the genital areas, it can be in between the digits, the toes, the fingers, you understand? So it can be anywhere. And the bad thing about it is that if a diabetes will develop infection in any of these regions, and you know, one thing that characterizes infection is that sometimes, especially those ones on the skin, they can be itchy. And the temptation to start itching them is there. And in the course of trying to itch, you know, they develop sores. You understand? And these sores may never heal because the blood sugar is not controlled. You understand? The excess blood sugar also acts as a militating factor, you understand, to the soldiers of the body that would have curtailed that infection. So the soldiers in the body will not also be able to function well because they are in an environment that is not friendly to them. And that environment is excess blood sugar. You understand? So the infection can just begin to go. And if the infection is in the digits of the leg or the feet of the foot, it could actually ascend. And that is where you see many diabetics losing their limb. You understand? Their lower limb. And as a matter of fact, diabetes mellitus today is one of the leading causes of amputation worldwide. You see that people who are amputees, many of them, they may have developed that amputation because of a complication of diabetes on their foot that they developed.
All right, 052290573 is the number. Do give Dr. Sareme a call so that he can give you answers to all of your questions. Hello, caller. Good afternoon. Hello. Please, when you're calling, reduce the audio level on your radio, on your television set. Hello. Hello. Good afternoon. Hello, I can hear you. If only you will reduce the audio level on your TV set. Hello. Good afternoon.
Good afternoon.
Please tell us your name and ask your question.
Good afternoon.
Good afternoon. Reduce the audio level on your TV because.
This John from Benin.
All right, John, how are you?
I'm fine.
All right, John, go ahead with your question. John, I'm going to let you go because your audio level on the television set is high. Hello, caller. Hello. Either you move away from where your television set is if you do not want to kill the audio. Hello. Hello. When you call, reduce the audio level on your television set. And this is not a children's program either. Okay, 052290573 is the number. Give us a call, reduce the audio level on your television set. Now, doctor, you know, often a time when you go through social media, hello, caller.
Hello.
Hello, good afternoon. Hello, good afternoon.
Hello.
Okay, we'll have to let that person go now. It's like the person is not hearing me. Please turn down the audio level on your television set. Kill the volume, come up for your TV, okay? If we have to speak pidgin, let's do that so that you can understand me and I will understand you. Hello?
Hello.
Hello, good afternoon.
Hello.
Hello, good afternoon. I can hear you. If only you will reduce the... Good afternoon.
Please no one dey talk for chest problem. I get chest problem.
You get chest problem?
Chest.
Okay, now diabetes we dey talk about this afternoon on the program, okay? So we'll have to let that caller go now. The topic is on your television set. We are looking at diabetes today, okay? We'll bring a doctor to talk about chest some other time. Hello, caller, good afternoon. Okay, while we're waiting for calls, doctor, hello?
Hello.
Hello, good afternoon. Hello, good afternoon. All right, we seem to be having some kind of problem today. All right, doc, you go over social media, you see different kind of drugs. This drug will cure diabetes 100%. This drug will you know, give you everything you want. You won't have to depend on drugs anymore. And you see a lot of persons keen into that. What's your advice on all of these things we see on social media? Different kind of drugs, all sorts of supplements, all sorts of herbal drinks.
Yes, we see where sometimes there's always a good and a bad side of something, you know, and that is where we have found ourselves in this era of social media. Anybody can put anything on the internet, and anybody can look at them. You see, diabetes, first of all, it's not curable.
It is not curable.
It's not a curable disease. It's actually a chronic disease. You know, the thing about diabetes is that, you know, we already established that it could be as a result of absolute lack or relative lack of insulin. And that insulin is produced by an organ in our body that we refer to as the pancreas, the beta cells of the pancreas. Now, if what damaged that cell and led to a relatively reduction in the production of that insulin is removed, you know, the individual may begin to, you know, have control over his blood sugar. And it may apparently look like the individual has been cured.
Okay.
You understand? We've seen cases where some persons were diabetic for a few years, and then after some time, their sugar was not just being controlled. And at other times, their sugar may not even start going low. You understand that you will not even begin to advise them and say, be taking sugary drink. You understand? Sometimes, at those times that the blood sugar is not getting controlled or getting low, some complications may have begun to set in. And one of the very dangerous complications that may have set in at that time might just be the kidney complication. Because the kidney also help to release or secrete insulin. So if the insulin that the kidney is supposed to produce is also being hampered, that can also bring about either the blood sugar dropping or even going high. So at the time that they might just have be achieving good control, sometimes it might mean that the complications are already setting in. You understand? So there's really no one drug that cures diabetes. Like I said, it's incurable. There's no one drug that cures it. What at the best, what drugs can do is to control your blood sugar. Everybody have a level of blood sugar. As a matter of fact, it's a blood sugar that we have that enables us to carry out our energy requiring day-to-day activity. You understand? So, and there's a range of a blood sugar value that you should have that is considered normal.
Okay, let's look at the range that is considered normal, the one that is considered abnormal, and the one that is considered a risk.
Yes, you see, first of all, before looking at the range.
Okay, Doc, let me take this call. We'll come back to you. Hello, caller. Hello. Good afternoon. Please tell us your name and ask your question.
Daniel from Delta.
Okay, Daniel, how are you?
Fine, thank you.
Go ahead with your question, please.
Which are some of the food that one can take to boost insulin naturally?
What the food somebody can take to build insulin naturally?
Yes.
Okay, doctor, are there food one can take to build insulin naturally? Thank you, Daniel.
Yes, well, there's really no food you can take to build insulin. Insulin is an enzyme. You understand? Yes, it's an enzyme, and where it comes from, in the body, is what most times is the problem. Where the insulin comes from. You understand? So it's either the insulin is not coming enough, or it's coming out, but its actions are not being effective.
Okay. You know, perhaps that's why some persons take bitter leaves, neem leaves and all of that to say, okay, these leaves are quite bitter, let us take it so that to boost insulin production.
Well, let me correct that impression. People actually take bitter leaf with the notion that bitter leaf has less sugar, or it has chemicals in it that can reduce blood sugar. But I don't know if that has been proven.
Okay.
If it does, it would have been formulated into medications that could be used to bring down the blood sugar. And what many people do, especially those who are non-medical professionals, what they do is that they go to the chemist shop to get some of these diabetic drugs and probably even add it to the bitter leaf to control their blood sugar. So if you are taking bitter leaf to control blood sugar, for me, you are actually a vegetarian. You are just dieting.
Okay.
You understand? So why not just prepare the vegetable and use it the normal way you use it for your food or your meal? You understand?
Okay.
So that's vegetable. So you could get all the minerals and the vitamins that you find in vegetable in the bitter leaf.
Okay. Hello, caller. Good afternoon. Okay, Chikamso, go ahead with your question.
What food do we take in the afternoon?
What food do you take? Okay, Chikamso is a child. Chikamso, don't worry, we'll bring a kiddies program for you to contribute. So let's leave that. What food do you take in the afternoon? Don't worry, we'll bring somebody to discuss that with you. Okay, you're talking about the range now.
Yes.
The sugar level range, yeah.
Yes, I said before we look at the range, let's look at the various modalities of monitoring or testing.
Okay.
They are categorized into different forms. You have the one we refer to as a fasting blood sugar or fasting blood glucose. That is the one you do first thing in the morning. I haven't fasted for overnight for an average of 8 hours. You understand? So that is fasting blood sugar. So any value that is above 126 milligram per DL,
yes,
it is considered as diabetic.
Okay, Doc, let me hold you there. Hello, caller. Good afternoon.
Hello, good afternoon.
Please tell us your name and ask your question.
I'm Ken.
All right, Ken, go ahead with your question. Please, the question should be on diabetes.
Okay, a situation whereby a patient has a swollen leg. That patient has a swollen leg. So what advice would doctor have?
Is the person diabetic?
Yeah.
The person is diabetic and the person has swollen leg.
Yeah.
Okay, Doc.
Yeah, you see, we were talking about complications. Just now. By the time an individual starts having swollen legs, that means he's now retaining water on the legs, retaining fluid on both legs. And that is one of the early signs of kidney involvement in diabetes. So that kind of person needs to go and see a nephrologist,
okay,
a kidney expert, who will now tell him or her what to do.
Okay.
You understand? It's not just enough to go to the chemist and take water pills that will now make you to start urinating the water that has gathered. Meanwhile, the diabetes that is causing that has not been controlled to an appreciable value.
Okay.
Because, like I earlier mentioned, that we all have blood glucose, blood sugar in our blood. So it's a values that is most important. It's a range of values that we all have that is important. So for a diabetic patient, there is a range of value that should be a target for them. And anything outside that is considered not controlled. And the effect could be complications developing in these organs like the kidney. And one of the ways that manifests is that the person may now begin to retain fluid on both legs.
All right, so see a doctor, please. Hello, caller. Good afternoon.
Good afternoon. How are you doing?
I did fine. What's your name?
My name is Ngozi.
Okay, ask your question.
Low sugar. I can't see well.
Okay. Okay. You have low sugar. How do you know you have low sugar?
I went to test because I'm not feeling well. If I want to mammogram, it looks like I'm going to die.
Okay.
So I now started taking they start to take carbohydrates.
Okay.
So as I start taking it, I go test. 986, they say it's okay.
Okay. Okay, in the night you used to piss more than 3-4 times. Okay, doctor will answer you now.
Yes.
Okay, thank you.
Everything to the extreme is not good for man.
Okay.
Everything should be average. You know, we are talking about high sugar now, which is diabetes mellitus.
Yes.
There is the other side of it, which is low sugar.
Low sugar.
And as a matter of fact, the medications that people living with diabetes take, the essence of using those medications is to bring the sugar down, but not to bring it down to the level of now too low. And that brings us to what should be the normal range. The normal range of blood sugar that a healthy person should have is 70 to 110 milligram per dl. You understand? So anything below 70 is already tending to low. You understand? And anything above 110 is already tending to high. I'm talking about fasting blood sugar now, which is more appropriate, not the one you do after you have eaten. That one we refer to it as the random blood sugar. So for a fasting blood sugar, the normal range of values for a healthy person is 70 to 110 milligram per dl. So the mama that is talking about low sugar, if you go to check, the machine must tell you what is the value. Although there are some self-monitoring machines that if it's actually very low, it may not be able to give you a value.
Okay.
It will just tell you low. Low. You understand? And it's also, if it's also very high, it may not be able to give you a value. It will just tell you high. And if it's the one that has that can give a sound, it might tell you emergency. Really? You should see a doctor. Yes. You understand? So for a low sugar, anything already going below 70, we consider that as low. If it goes as low as 40, dangerous. Yes. If it goes as low as 40, the individual may not know where he or she is. He or she can actually go unconscious. You understand? And you could find low blood sugar in people who are living with diabetes. As a matter of fact, they are the ones that suffer low sugar more than other persons. And then a few other people you may find with low blood sugar are the elderlies. And the reason is not far-fetched, because these people hardly eat for one reason or the other, which could even be as a result of their dentition, that's their tooth or their teeth. You understand? So they hardly eat. And of course, if you don't eat, your sugar may start going low. So other than those who are elderly, diabetes patients are the ones that usually will suffer low blood sugar. And the reason is because they use drugs that bring the sugar low. As a matter of fact, those drugs are referred to as glucose lowering drugs. You understand? That is why you don't just go anywhere to seek health care when you are passing urine frequently. Because the person who is not trained to treat humans may think that the fact that you are passing urine frequently may just be because of diabetes, because that's what the layman commonly knows to be diabetes mellitus. And they start pumping you with drugs. And they start pumping you with the drugs, not knowing that there are other things that can make you to begin to pass urine frequently. You know, for instance, like cold weather, that could make you to begin to pass urine frequently. Like if you have taken so much water, especially late in the night, you may have to wake up to 2 or 3 times to go and pass urine. And if you also have infections, what we refer to as urinary tract infections, that can make you to go and pass urine frequently. And then for men, if the individual has got a prostate disease, a prostate that is now getting big and is now compressing on the bladder, you understand, that individual will also begin to pass urine frequently. And so for a lay person or a chemist man who don't know all these other possible causes of why somebody may begin to pass urine frequently, and you go to just lay your complaint and say, I'm passing urine frequently, you know, they can give you glucose lowering drug or blood sugar lowering drug,
and that may just land that person
in problem into the hospital as an emergency patient, because your blood sugar is going to go drastically low and you won't know when they will carry you to the hospital. And many a times, these people may not even check. They may not even check your blood sugar to know what exactly is a value. For the fact that you have laid your complaint to them that I am passing urine frequently. So the likely thing to them is diabetes mellitus, but that's not always the case.
Okay.
Before I now started taking, they started to take carbohydrates.
Okay.
So as I started taking it, the that I go 10, 9, 86, they say it's okay.
Okay.
So doctor will tell us that I want to continue to eat. But in the night, I used to eat more than 3-4 times.
Okay. In the night, you used to piss more than 3-4 times.
Is it good?
Okay, doctor will answer you now.
Yes.
Okay, thank you.
Everything to the extreme is not good for man.
Okay.
Everything should be average. You know, we are talking about high sugar now, which is diabetes mellitus.
Yes.
There is the other side of it, which is low sugar. And as a matter of fact, the medications that people living with diabetes take, the essence of using those medications is to bring the sugar down, but not to bring it down to the level of now too low. And that brings us to what should be the normal range. The normal range of blood sugar that a healthy person should have is 70 to 110 milligram per dl. You understand? So anything below 70 is already tending to low. You understand? And anything above 110 is already tending to high. I'm talking about fasting blood sugar now, which is more appropriate, not the one you do after you are eating. That one we refer to it as the random blood sugar. So for a fasting blood sugar, the normal range of values for a healthy person is 70 to 110 milligram per dl. So the mama that is talking about low sugar, if you go to check, the machine must tell you what is the value. Although there are some self-monitoring machines that if it's actually very low, it may not be able to give you a value.
Okay.
It will just tell you low. You understand? And it's also, if it's also very high, it may not be able to give you a value. It will just tell you high. And if it's the one that has that can give a sound, it might tell you emergency.
Really?
You should see a doctor. Yes. You understand? So for a low sugar, anything already going below 70, we consider that as low. If it goes as low as 40,
dangerous.
Yes. If it goes as low as 40, the individual may not know where he or she is. He or she can actually go unconscious. You understand? And you could find low blood sugar in people who are living with diabetes. As a matter of fact, they are the ones that suffer low sugar more than other persons. And then a few other people you may find with low blood sugar are the elderlies. And the reason is not far-fetched, because these people hardly eat for one reason or the other, which could even be as a result of their dentition, that's their tooth or their teeth. You understand? So they hardly eat. And of course, if you don't eat, your sugar may start going low. So other than those who are elderly, diabetes patients are the ones that usually will suffer low blood sugar. And the reason is because they use drugs that bring the sugar low. As a matter of fact, those drugs are referred to as glucose lowering drugs. You understand? That is why you don't just go anywhere to seek health care when you are passing urine frequently. Because the person who is not trained to treat humans may think that the fact that you are passing urine frequently may just be because of diabetes, because that's what the layman commonly knows to be diabetes.
And they start pumping you with drugs.
And they start pumping you with the drugs, not knowing that there are other things that can make you to begin to pass urine frequently. You know, for instance, like cold weather, that could make you to begin to pass urine frequently. Like if you have taken so much water, especially late in the night, you may have to wake up to 2 or 3 times to go and pass urine. And if you also have infections, what we refer to as urinary tract infections, that can make you to go and pass urine frequently. And then for men, if the individual has got a prostate disease, a prostate that is now getting big and is now compressing on the bladder, you understand, that individual will also begin to pass urine frequently. And so for a lay person or a chemist man who don't know all these other possible causes of why somebody may begin to pass urine frequently, and you go to just lay your complaint and say, I'm passing urine frequently, you know, they can give you glucose lowering drug or blood sugar lowering drug.
And that may just land that person
land you
in problem.
into the hospital as an emergency patient. because your blood sugar is going to go drastically low, and you won't know when they will carry you to the hospital. And many a times, these people may not even check. They may not even check your blood sugar to know what exactly is a value. For the fact that you have laid your complaint to them that I am passing urine frequently, so the likely thing to them is diabetes mellitus, but that's not always the case. You get my point now. So
it will be like a case of penny wise pound foolish.
Exactly.
Unfortunately, chemist is the place people run to without going to the hospital, but because the idea of a hospital being very expensive is what we usually carry at the back of our minds. Let me rush to this chemist and get this drug. Why am I going to hospitals to suffer myself, you know?
That's very correct. And that's
quite
why
unfortunate.
Access to care is an apt thing in this year's World Diabetic Day.
Okay, why is healthcare so expensive in this part of the world? It's not accessible. Even the government hospitals, we still have to pay something. Hello, caller. Hello, good afternoon. Hello.
Good evening, ma'am.
Thank you. What's your name, please?
My name is Johnson, calling from Edo State.
All right, Johnson, go ahead with your question.
Okay, I do have frequent urination tonight.
Okay.
And I observed that once I eat gari and rice, I normally have such a frequent urination, but up to 3 or 4 times, 5 times at times.
Are you diabetic?
So I went to medical laboratory. That is medical laboratory checkup.
Okay.
So they said everything is normal, that my sugar level is normal. That is, they had 108.
108.
Okay. 108.
Okay.
So the person that I asked them, so what is the problem that summertime I eat gari, I will be having frequent urination in the night.
If you eat gari,
Yes. Hello, ma'am.
is it if you eat gari or garlic?
That is gari.
Gary, I call on Gary now because you were saying Gary. I was wondering which one is Gary again. Okay, if you eat Gary as in eba or rice.
Yes, eba to make eba.
Or rice.
Make eba.
Or rice.
Or if I eat it any day that I can observe something like that. Like
okay,
rice,
good. Okay,
also,
good. Doctor will give you an answer now.
Included.
Okay. All right, doc.
So when I went to the laboratory, this thing, that is 18, that is okay.
108.
And
okay, good.
Advised me to go for sugar, drugs.
Okay.
Then he said I would advised me to go and check for my BP.
Okay.
I also went to my this thing. They say it's okay.
Okay.
So I don't know.
But you are worried that you urinate frequently at night, despite the fact that they say your sugar level is okay and you don't have a BP. That's your worry now, Abi? Okay, so
Hello?
doctor.
Yes, you see, I have just talked about some of the things that can make somebody pass urine frequently. You see, when the frequency in passing urine is now more at night, it also portends some other sinister problem.
Okay.
And one of them could just be kidney disease. And for young people, kidney disease now is now going on the increase.
On the increase.
You understand? So if he has done blood sugar and they said the blood sugar is normal, did they check the urine?